Hello, Games for Change Festival audience. My name is Carrie Shaw, and I'm the CEO and founder of Embodied Labs. I'm here with Dr. Kelly Aldrich to moderate our closing virtual keynote and Sparkle Side chat about sparkle and joy and transformative design to combat burnout and burden. Dr. Aldrich is joining us with an amazing interdisciplinary background after a lifetime career and still building the future of innovation and technology. Dr. Aldrich is the Director of Innovation at Vanderbilt University School of Nursing. She's also the Chief Informatics Officer at the Center for Interoperability, and she has a secondary appointment in the Biomedical Informatics Department, also at Vanderbilt. Kelly sits on a Health and Human Services Cybersecurity Task Force for clinicians who are future-gazing, and that's 5 years in running. And Kelly also sits on the American Nurses Association's National Innovation Advisory Council. She also, with the National Council for the Office of National Coordinators, is part of the Interoperability Standards Work Group. And Kelly is a board member for an innovation startup called Relay Response, using tech to provide improvements for CPR. And finally, Kelly has experience with a range of corporate to venture and startup ecosystems. And she is this year invited as a judge for Microsoft, J&J, and other nurse hackathons. She's provided mentorship and leadership in the field of informatics and nursing. And I'm so excited that she is here with us to share with us her stories, her design thinking, and where we can take caregiver trauma and burden and translate that into joy and sparkle. So Kelly, I'm so glad you're here today, and I'd love to hear from you. Why this topic? What made you want to talk about this today?
Thank you, Carrie. It's a real pleasure, but also a little intimidating, I have to tell you, to speak on behalf of 28 million nurses across the globe. This is really just a really important topic. So I do want to break it down where I am an advocate for awareness for the well-being of nurses. I also would like to take some time and talk about why there's so much unnecessary stress in our healthcare systems. And then, as you said, let's talk about what we can do together as a community to create some solutions that will help bring that sparkle and joy back, hopefully within gaming, to our caregivers who are really caring for us. And so, as I said, awareness and advocacy for nurses' well-being. What we have to understand that just in the US, there are 4 million registered nurses. That is a huge number. But the scary part about that is, quite frankly, is that the turnover rate for nurses is almost at 20%. We have vacancies of 30% in hospitals, nursing homes, hospice cares across our country alone. It's said that globally, we have lost over 1 million nurses in our industry over the last 1 year. This is pretty devastating if you think about yourself. If you become ill, if you need care, if you need to seek care that is coordinated through wherever you might be needing help through a trauma, a car accident, an illness, an infection, there are 1 million less nurses today taking care of people. And so I just really want to point out that not only has the pandemic created these sort of strains and stresses, but we're also looking at this thing that we call burnout. Now, that is something that sometimes is a inflammatory statement. Nurses don't want to cry wolf by saying burnout. What they do want to do is they want to advocate for safe care environments. And not only for their patients do they want to advocate for safe care environments, they want to advocate for themselves. And so we get into this thing called moral injury and how this moral injury is truly affecting people, nurses, providers, caregivers going to work, and that's where we get this term burnout. We look at most providers, nurses, care teams work within the walls of a hospital. Now that's changing. People are going definitely outside the walls of the hospital, but within the walls of the hospital, as I've been interviewing many of my nurse friends to say, what is it? What is causing all this stress and trauma? What is going on that 35 years ago when I started nursing is so different now? What is going on? And I think what I heard through many people helping me with this topic is that there are so many unnecessary strains and burdens put on the care teams today, inefficient tools, lack of interoperability. So let me give you an example of that. I used to be a critical care neurotrauma intensive care nurse where I worked over 20 years at the bedside taking care of people who in a split second had their lives changed and they were put in the bed in front of me. I had to deal with them and taking care of them as human beings, try to cope with what has happened to them, that they have been admitted to my intensive care unit. But I've also have to cope with different medical devices, meaning there are IV pumps, there's monitors, there are kidney machines, there are heart pump machines. There are approximately 13 different medical devices around a patient's bed. And when I say unnecessary burdens, what I want to point out to this community in particular is that none of these devices talk to one another. Not one IV pump talks to the other IV pump. They don't talk to the pharmacy um, ordering system. They don't talk to the ventilator to say, hey, this person's getting too much fluid. We need to stop that. So if you just imagine on your phone, and you pick up your phone to, how many times a day, I've heard so many different statistics on this. So many people pick up their phone and they have to interact with their phone. But think about if you had to, for each app you went into, you had to pick up a different phone and you had a different login and you had a different way to log into that phone for everything that you wanted to do in coordinating yourself in your own life and how you are operating. And so that's the burden that we're putting on the clinicians. We're asking them to log in separately to all these proprietary different medical devices when they're really just trying to coordinate care and take care of a human being. And so that really, really is unnecessary burden. And healthcare is not going to fix itself. That is for sure. The banking industry or the airline industry that we're often compared to, they have removed error traps and designs. They have created the pilots being able to sit in clearly designed, efficient, effective environments that are designed to eliminate errors. And clinicians don't have that advantage. So I do definitely want to point that out. So these are very stressful scenarios that human beings are put under and are really asked to work in these stressful environments that are really not necessary.
And so, Kelly, thanks so much for sharing all the kind of background and framing for why now, why today, and how do we
Mhm.
build this awareness of what's happening with our healthcare providers and clinicians. And I think your voice representing the nurses here today is so important. And if you could frame for us to tell us a couple of examples of what really inspired design thinking for you, where you started to see some opportunity to relieve this burden or start to try to work on that puzzle.
Thanks, Carrie. I think it is really important to understand that each clinician has their own personal story that brings them into this sort of role. And as I shared, I was a critical care nurse for many years, and I myself was attacked by a patient, and which left me unable to work at the bedside any longer. So I had to have multiple back surgeries, and so this was something that I really struggled with. And where was I personally going to find my new joy, right? What was I going to do? I um I started listening to a presentation about computers and informatics. And I'm pretty certain that I heard angels singing above these people's heads that they said, you could use data to improve care. You can use technology to actually create seamless work environments. You can use technology to reduce burden on caregivers. And I was quite certain that I was being punked at that point because I kept looking around thinking like they seriously cannot, this can't be happening. And so I got into informatics in a way to automate care environments to improve the experience and the satisfaction of the nurses and the providers that I represented. And so I actually became the chief nursing informatics officer for a corporation called HCA. We had 170 plus hospitals at the time, and through a series of years and in roles and changes, I had the opportunity to represent the entire nursing industry from HCA, so over 90,000 nurses. And
Wow.
what could tech do for them? And what I kept hearing was from vendors and solution leaders, this is what you need to do. This is what you need to do. This is what you need to do. And finally, I had to call a timeout, and I got on a chief nursing officer call. I took about 15 minutes, and I would like to hear from you all. Could you all ask your nurses, your nine, this is a large footprint across the United States. Could you ask them to take 3x5 cards in an area where there isn't technology or there could be technology? Could you have them write that down and send those over to me?
So
So I,
So you're
mhm,
getting to, you're saying there's 90,000 of these
mhm,
nurses and these collective voices I have to represent. And you mean you
mhm.
sent them like a physical, that you said fill out this physical note card and
This
mail it
little
to
note
you.
card. Yeah.
Okay.
Hmm.
So how
Yeah.
did that turn out?
Well, it was actually kind of fun because I was really holding my breath. I didn't think that they would even have time to fill out one, but I got over 800 responses within about 2 weeks. And I thought that was pretty darn good. And what I was able to do with some graduate students, because there is research involved in this, in examining what is needed within design thinking and human factors and all of these elements of process of care and people process technology. So what we did is we bucketed these things and we said, hey, clean up the electronic health record, make me mobile, so give me these solutions. And then they came up with these smart room concepts around how could you just make my life easier by infusing technology, which is really, this has been probably at least 12 years now, and it has really set me on this journey to help find this Sparkleville that we have talked about for so many years. How can the infusion of technology, and you might laugh, but people were actually talking about Google Glass before Google Glass was created, where they could actually see things, see the vital signs of their patients, see this, their intake and output. What were the meaningful measures that they didn't have to go to a separate device and pull the data out? So how could they coordinate care? And I'll tell you, it was not hard to sell these ideas to leadership. They appreciated the voice of the clinician. They supported the voice of the clinician, and they put a ton of funding towards it for us to realize that strategic plan to actually improve the care environment for the nurses. So that was a pretty advanced project working as the chief nursing informatics officer. What you had asked, what could we do? There was, where was the opportunity? Where's the opportunity? I will tell you that anytime that there is a workaround, so you have to invent something. And nurses and physicians, that is not our language. We call that a workaround. So if something isn't working as designed, we create a workaround. And there is the lack of repeatability, the lack of redundancy that potentially could lead to harm, unintended consequences. Nobody wants to be put in that position. But when things are not designed to support and reduce burden on the clinician, that's when you have these medical errors that you hear so much about. That causes moral injury to caregivers. There is not one clinician who wakes up in the morning saying, I think I'll go to work today and harm a patient. Or possibly because I wasn't able to be present when they needed me, lead to an untimely death. These are the realities of what clinicians are working in. And so I think that together as a community, we do have to address this culture of silence that we have around depression, around there is a significant amount of suicide in the physician and nursing community. And I feel as though we have to be talking about these things in order for people to understand that nurses and doctors, they're human,
Yeah.
but they also need the support, right? They need the well-being timeouts. They need the opportunities to recharge their batteries,
Mm-hmm.
and frankly, they're not getting them right now.
Yeah. So in that problem that you've just outlined so well for us of why now and why today more than
Mm,
ever, after we've been through now a couple years of the pandemic and still going. So as we close out today with our final thoughts for the audience, tell us what is your call to action for us that are watching? Like, where can we find sparkle and joy and bring this to the environments that you're talking about?
Yeah, I love this opportunity. And I think that this is just the beginning of the discussion that we should have. We could go on all day, all week talking about this topic and how we can help. We need to understand that we need the appropriate technology solutions that are immersive, things like sensory rooms, things that will bring them back to be able to be grounded and re energize what they originally came to the profession for. We have to recognize that clinicians are not superheroes. And I do want to point out that is a very toxic term to clinicians. They do not want to be martyred. They want to be given the tools and the resources that they can care for human beings, that they can have time for themselves so that they can do the best job for their patients, both in care coordination and at bedside care. So I think bringing this joy and sparkle has to be, we have to look outside of healthcare and look to gaming to help us with this and how we infuse that. And I want to add one last thing. One of the nurses that I spoke to, she said, oh, by the way, I want to thank the person who created Tetris because it has saved my life, where I've been able to go internally and just play a game and have that kind of joy and sparkle. And so I think that's what should lead us to really forming what could Sparkleville be like for our clinicians to improve their inner peace and their well-being.
Well, thank you so much, Kelly. This was really inspiring to learn from you. So with that, I will close
Yeah.
our fireside sparkle side chat and take it to our next session.